Thank you very much. What a day to be here in Germany. I have never seen that much forest in Germany. It's like familiar and Finnish person to be here in that place. And nice to meet you all also. So today we are talking about Terveystalo story, where we started, where are we now. So we go, what is Terveystalo actually? It's a cash flow machine, and why Finland is a good environment to grow innovations in digital health, and how we have built our telemedicine capacity, and what we are doing right now on our own EMR, and we are going to be ready for AI. And little key learning at the end of the presentation. Shortly about me, first I'm a doctor. I have been working 10 years as a doctor, general practitioner and an occupational health doctor. And after that, at the last 10 years, I have been creating, developing, planning, and being a business responsible for advancing telemedicine in many businesses. I have been co-founder of a couple of startups, but last 4 years I have been in Terveystalo, first starting with digital health side and then moving to all our facilities. So I have been last 2 years Chief Digital Medical Officer, and that's the reason why I'm here today speaking about that. And last couple of months I have also taken new responsible. I'm a chief physician of appointments, because if you are creating new digital technology, it's not only about technology, it's much about implementation and processes. So I have both sides now on me. But first about Terveystalo. Because if you didn't have money, you couldn't invest. That's why I go through that little session. Terveystalo is a quite young company, 25 years old. First, we are like a merchant, a compounder company. We bought tens of small clinics in Finland. And then we grow in a hospital side, and we are also grow to oral health sessions and staffing business. But our core are in occupational health, and that's a Finnish specialty. If you have business in Finland and you have any person working in your company, it's mandatory that you have to have occupational health contract with some provider. So that makes us a very good business opportunity. And I think that's one of the main reasons why we have that consolidated market in Finland, because there's a lot of national companies which needs national occupational health companies to support them. So then there is three main providers in Finland have about 80% of the occupational health market. So the Finnish market is very consolidated, and Terveystalo is the main player in the occupational health market. And after listed that last 10 years, we're still growing, and we have been quite good cash flow machine. So we could invest in technology. And we are a market leader in all three our main business sides. Occupational health is the number one for us, but also out-of-the-pocket consumers and insurance payers. But as you see the gray box, the public pay, public provider, that's the biggest part in Finnish healthcare, and we couldn't go to that market. Of course, we want to go to that market, but it's not possible. And what we provide today, our new strategy is integrated care, and it means that we don't just want to we just want to give a single appointment. We have to provide integrated care which is fluent, caring, and also effective for us. We have a large prevention side because of occupational health, and that side we have integrated new technology also. Later today you hear about Nightingale, which is a very new high-tech innovation for us, which we have integrated in our occupational health system. My main focus is on the primary care. And in primary care, we have most of our volume, most of our appointments, but we also have a high-level specialist care with surgery. So currently, Terveystalo is leading Nordic platform for health and well-being. We are number one in private healthcare market. We have a very good brand. We have almost 400 locations in Finland, and also in Sweden we are number 2 in occupational health. So we have a large customer base, we have large volume, so that's a good base to digitalize. And how about Finland? How many of you have been in Finland? Oh, quite many. Nice to see. Finland, it's a land of 1,000 lakes, so we are divided with lakes. So then, even before COVID, the long distance is familiar for us. In Finland, people asking why only 2 meters? We need 10 meters. It's much more familiar for us. And then also, you know Nokia. Nokia it's not only the company, it's the ecosystem. In Finland, there is tens of thousands of engineers familiar with IT technology. And of course, because we are Finnish, we are connecting people with text messages because 160 marks is enough for Finnish people. We don't need any more communication. So the Finnish has been in many years number one in EU ranks for digital society. So thus it's clear that in Terveystalo it's clear that we are leading telemedicine almost globally. We have did telemedicine in 10 years already in Finland. And that's what I have been doing in last 10 years. I have did tens of thousands of chat and video appointments with the patients and developed new technology. Chat, it's very easy, it's very affordable. You could chat everywhere with your doctor. It's a very narrow interaction, but it works quite well. Phone appointment, it's easy and familiar. Everyone could speak on the phone. Video appointment needs a little bit more, it's first awkward, but as we see later, after COVID, it's not anymore. The video appointment is now one of the golden standards for us, and only touch is missing. If you are familiar with video appointment as a doctor, it's very effective method. So, what have we done in Terveystalo? First 10 years, we are centralizing. We grow, we buy new companies, we create joint call center, and there is good stories. Before we have a one call center, every locations have own numbers for booking. And the doctors say that, oh, I don't want to be online booking and joint call center, so keep me out there. And then after we have online booking 1 week, the doctors came back and said, I have no patients. Could I go also to online booking? So the doctors follow the customers. Remember that. Where the customer is, doctors came there. After 2010, we create our first digital generation, iPhone app, online application. We create appointment web booking, and 5 years before COVID, we already have remote services, chat and video appointments. And then a couple of years before COVID, we create everything again. That's very typical if you invest in technology. But then 2020, when COVID came, we are ready for remote appointments. And last couple of years, we are going to scaling our technology. We start to create our own software as medical device, and also create our first own EMRs. I show those later for you. So what we have, we deliver third-class digital solutions for customers. About half of the Finns are registered users. How many of you have the same number in your market? And almost every third of the Finns use monthly our services. And currently, about 75% of appointment bookings are doing self, so that gains us about 50 million profit every year. So remember, it's very expensive to have those people answering phone. What happened in COVID? we already have a chat. We have their doctors, we have the couple of patients, but when COVID arranged, you could see that video appointment rise high because we start to use team meetings, and then because we use team at work, it's easy to use Teams or our own video appointment services also with the doctors. And same with the doctors in the right-hand side. When the patient came to video side, doctors should also go there, and we could scale at the weeks to the high numbers. And if we add the phone appointments there, the numbers are doubled. So we could create very fast move to remote appointments. And a very common question for me about remote appointment is that which symptoms you could care on remote appointments. And I think that that's a wrong question because it depends in many sides. So I create a remote appointment window application where you can see there's 4 factors, and that's one of the reasons why Terveystalo is so good in remote appointments, because we have educated our doctors to remote appointments. It's easy for them to use. We have a good technology. We have easily integrated chat, video, phone appointments, and we have no limitations in our service system because we are a national provider. If the patient is not able to cure in remote appointment, we could send the patient to near appointment easily. And also our patients, most of our patients are working age because the occupational health is our strongest customer side. So our patients' characteristics also support remote appointment. So because of all those 4 reasons, the remote care window in Terveystalo is quite large. And nowadays, it's about 30% of our appointments are remote appointments. But there is still a problem. The patient didn't know in which symptoms they could go there. So we have a successful startup collaboration with EST Healthcare. We integrate symptom checker in our Terveystalo application and a customer journey. First, we ask a couple of questions about the symptoms, and then we provide suggestions. Which doctor you should go? Is it remote care possible? Or is it chat, video, or phone where you should go? Or is it emergency situation where you should go emergency into emergency services? Or could you wait a couple of days and then go to appointment? And that helps a lot. So our quality issues in remote appointments gets much lower after that implementation. So we have best UI for customer, but what about our professionals? Ironically, we have so many great tools for our professionals. I think that's familiar for all of you, that we have old non-integratable EMR in the middle, and then we have a lot of other applications. And you have a lot of startups knocking your door and providing you one more application for doctor. Sorry for our startup people in here, but that's a problem also for us. And that's why we start to solve that problem in the middle, and we start to create our own EMR. And we start with chat appointments. In chat, we always use 2 applications. The first one, where we chat with the patients. We have the communication platform, and then in the background you can see there is an EMR where we should create notes and all those other things we have to do. We start to plan. We go through all that customer path and professional workflow. We discuss with the professionals that what part of the patient data you really need when you have a chat appointment, because in EMR we have about 1,000 different modules or data points, but in chat appointments it's very narrow what you need. So we could create a very neat. First you have a symptom checker information, and then there's my chat discussion with patient. He could integrate their picture at all. And then I could see easily patient data. I could check the contrast, search is the lab possible because this has a sore throat. I could check basic health information. Then there's an AI create ready that text. For me, I could easily check lab results which I need and billing information. So there is only a couple of things I should need on chat appointment. And I'm especially happy about that first thing, which goes quite fast. But we already have integrated artificial intelligence that you could send all that discussion data and symptom checker data to AI, and it creates that note ready for you. And that's very good reason why I think that you need an own EMR and integrate artificial intelligence inside that so that it's really effective work. So, why we start with the chat appointment? Complexity is very low, it's low risk, and the number of professionals we need to educate to the new tool, it's very small, so it's easy. It's like a, how to say, low-hanging fruit for us. But then, because we see that we could do that, it takes about 6 to 9 months to create that own EMR. We are looking for how to go forward with all appointments. And we announced a couple of months ago that we are creating Terveystalo Ella, our own EMR. And as old EMRs are more like paper style doctor work scanned to computer, our new EMR is more like integration platform. I go later a couple of design principles we have, but one of the main things that we always thinking that how AI will change our work in the future, how AI will change doctor's work, and what help doctor need during the appointment, which AI could provide. And once more, we start with the process. And there is 2 main processes we are looking for. First, there is a workday process. Because if you didn't go through all that workday process and you create a lot of efficiency, it happens somewhere. I think it's a thing called Parkinson's law, that the work takes always its time you give it. So at the same time we create efficiency, at the same we have to redesign our workday. So that's we have 2 processes separately, which we are always looking for. How's the workday? What work? What billable work? What other work those doctors and other professionals could do in Terveystalo Ella? And at the same time, our basic process, appointment process. It's quite linear. It's quite same always. There is a little difference between specialties, between remote appointments, but still it's quite the same. And in design point of view, how many of you know double diamond in design principles? It's like first you have, if you think about that appointment process, first doctor asks very open questions like, could you tell me a little bit about your symptoms and how your symptoms has changed over the time? So we are like open-ended questions. We are opening our mind. And then after a couple of questions, we go to very narrow questions like, do you have a dyspnea? Do you have a sore throat? So we are narrowing, we are going to the working diagnosis. And then again, we are opening our thinking that if the working diagnosis is a sore throat and there could be angina, so what we are doing then? So we are just opening our mind, which are the every possible cure, diagnostics, every other things we need in that situation if there's an angina. And we think very widely. And then again, we are going to decisions. So there's a double diamond. So in different process steps, doctor need a different helps. It's always the same. We have to also know how the appointment is going forward. And that's one of the reasons why we are also integrating ambient scribing to our process. So if we have a live ambient scribing and AI is listening to that appointment, then we could also know that which part of the appointment process we are going forward, and we could help the doctor much better. Because we have a couple key principles in that medical design. Shortly, it's easy to do right. If you ask about doctors, they always want easy. But if you ask about managers, they want that right part. So we have to keep both. We have to give some easy to doctor so that we get that right at the same. Otherwise, it's very fast, but there is a lot of quality problems. So how we are thinking? First, we have to know what the doctor does with the features, and then what he is or she is thinking at the same time, because it's two different processes. And then also, we know a lot of root cases about quality issues. We have to think about, could we at the same time fix those quality issues? And in behavioral economics approach, I think you have the same problem than me, that the doctors are very autonomous. In Finland, our doctors they have a double autonomy because they are private practitioner, so they are not working in us, they are working for us, and also they have a doctor's classical autonomy. So I think easiest way to direct them is to create that direction inside EMR so that you couldn't avoid it. And also the second, currently we have the problem that we have a decision support systems, but it's very noisy. We typically have a lot of alerts for doctors. We have a lot of data for doctors. We have to much better know which data doctor need at that time. So, and doctor love to know that data. They didn't like that we hide something for them, but we have to make it easy to create informed decision intuitively. And also the last one, the power of habits. Currently, doctor's first visit, it's more like a craft work. It's a little bit artistic. And that's one of the root cases for quality issues. We have to standardize it. So what we are looking for, Ella, of course, we are still looking for money. So we could invest more in a later, but also professional experience is getting much better. And at least in that chat MVP, we have a very good experience that doctors love it. They said that the work is much easier, much faster, tens of percent faster than in a previous version. And care compliance, easy to do right. And as I said before, we are creating our own EMR so that we could integrate artificial intelligence inside. Shortly, people asking me, do I believe in AI? I said, follow the money. If the investors are believing AI, if you look at the S&P without Magnificent 7, it's not growing quite fast. So I think that also in healthcare in the future, the profits are going through technology increasingly in the future. And that's not linear. How many of you are in the first level of using AI, using ChatGPT, using Copilot, copy-pasting things there and back? Good. You are on the track, fine. How many of you are in the second level that you use AI agents, you have automated workflows? Yeah, nice. I think the first part is just learning how it could work, and which I could move to second level. And the same thing we are doing with doctors' work and also all that support work behind doctors. We are looking for 30% cost savings in our support processes with AI agents. And as you see, it's quite fast in the video, but we have that AI integration on chat. And if it's like copy that text, paste it somewhere else, do prompt, it's not that effective. Doctors are doing that. And the prompt is changing every time. So I think that we have to go to second phase, do system prompts, which we could also trust that they works, and then we could go forward. And still, in Terveystalo, we have one clear goal. We have one UI for professionals. And I think none of us know where we're going. What's the phase 3? What's the disruption where we are going? First, a couple of things. What's the most underused resource in healthcare? Any answers? I think it's patient. Patient, yeah, patient. Healing doesn't happen during appointment. It happens between appointments. And how many of you manage what happened between appointments? I think none of us. And that's a very big problem for us. For example, lifestyle care. How many of you get hired if your if your projects are like that? That you have meeting once a year and you have eat less fat and more vegetables and see you next year. It's not surprise that it didn't work. And it's not complicated. I think it's more like service design problem than technical thinking. Ask that one in your mind. Quite sure. So what you have to think, what's lifestyle? What's my lifestyle? What's my lifestyle compared to optimal? So you have to think of quite a lot. So I have 3 questions, short lifestyle mini intervention, which I use in every diabetes appointment I use. And the number 2 and 3, they are just classical sales things. Number 2, I'm looking for sales funnel, which thing is which is the easiest thing to go forward. And the number 3, remove obstacles of buying. That works very well. That's easy, very easy to do with the chatbot, and AI could do it 10 times better than average nurse. We have one problem. We have regulatory framework, and our EMR project, we have one full-time employer just constantly looking for regulations, that how we fit that. That's for our safety, but that's also that's a problem for me, because that's my personal thinking that in medical practice we have a lot of problems. We know that there is a lot of quality issues, but at the same time, every regulatory person is saying that GDPR, we couldn't do that. And at the same time, we have thousands of medical issues yearly. So if we didn't take any other risk, the patient take every risk. That's what I'm also thinking. A couple of key learnings. First, you have to grow. If you didn't grow, you have to buy things, and then you have a salad for solutions for your professionals. You have to centralize so that you could standardize and you could digitalize. You couldn't go to scale if you haven't digitalized, centralized, standardized, optimize your thing. This is like a track you have to follow. Of course, if you are in a very narrow field, for example, surgery clinic or something, you could buy a ready solution which fits for you quite well. But in Terveystalo, we are working in so large area that we didn't find any startup solutions that fits for us perfectly. And one question for you. Where is your organization on that journey? How are you planning to go forward? And see you on the roundtable discussion before lunch. Thank you very much.